The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about women's health issues. One of the big concerns with women is osteoporosis, and talking with us today about this important subject is Dr. Eric Shadle. And we're glad you're with us, Doctor. You practice obstetrics and gynecology, which means you deal with women and women's health issues all day, every day.
That's right. That's right.
This issue of osteoporosis, is it a big problem? Is it a big concern for women?
It's a very big problem. It's a problem that affects very many women every year. It affects men too, but much more commonly in women.
What exactly is osteoporosis?
Well, the easy answer is that it is bone thinning. The bone starts becoming thinner and thinner. We lose bone mass with age. Mm-hmm. And so we actually find at age 35 that we have the peak bone mass that we're going to have in our entire lives, and after that, on average at least, we start losing some bone mass.
So if we could look inside the bone and we were going to look at it and see exactly what was happening, what kind of things would we be seeing?
Well, the bone that is normally mineralized, and here we have a graphic showing the bone volume tissue, and that's an example of what bone is supposed to look like. I think we have another graphic that will show us how the bone is thinner, and that is what osteoporosis is. This would be an example we see with prednisone. That's a medication that is
a steroid type thing.
It's a steroid that actually will cause bone thinning. The architecture of the bone is changed so that there are fewer bony spicules. You see in this picture there that there's these dark lines that are kind of going up and down, mm-hmm. And then the ones that are going horizontally across the screen, there's not too many of those, and they're kind of breaking off. And I think there's one more graphic that'll show that even more, that there's big holes in these, what we'd call these horizontal struts. And that makes the bone very weak. Just like in skyscrapers, mm-hmm. you have the external structure, and then you have these struts, which are actually the floors, mm-hmm. can act as a strut across horizontally that gives the structure much more strength, and the same is with our bone. So if we lose those horizontal struts, then the bone fractures much more easily, and that's really the problem with osteoporosis.
So the significance of the problem, you said, is great, but what really happens when you have osteoporosis? What kind of things happen?
Well, the big problem is fractures. It's estimated that 1.3 million people have osteoporotic fractures in this country each year, and it's due to the low bone density. Half of these fractures are vertebral, that is in the vertebrae in your back. 1/4 of them are in the hip, and 1/4 are collies, or that's in your wrist. As you fall, you put your wrist out or your hand out, and you can break your wrist. And this, the estimated cost for this is $13.8 billion. It was in 1995, and certainly it's more than that currently.
Wow, so this is a huge problem. All kinds of people have that. You said here, as we were talking, that people that survive to age 90, they really have a significant increase in their risk.
That's right. We look at women to the age of 90, 33% of them will have had an osteoporotic fracture, and 17% of men. So, like I said, it's not just in women, but it's certainly much more prevalent in women.
Now, you've said that the what happens in osteoporosis is those horizontal lines, or the horizontal lines. Sorry, the vertical lines.
Yeah.
The horizontal lines are they're leaving, and
That's
everything
right.
kind of crumbles down. But what are the underlying causes of osteoporosis? I mean, what causes those horizontal lines to take a vacation?
Well, you know, we're told that that osteoporosis is a calcium deficiency disease. That's what we're told by the traditional medical establishment. That's what we think of with osteoporosis is calcium. But actually, there are several risk factors that have been identified. Some of them include gender.
Females, probably.
Female gender, as we've talked about. Another is previous fracture. If you've had a fracture before, you're more likely to have another one. That would make sense. Tobacco use is another independent risk factor.
Wow.
So women as well as men who smoke will increase their risk of osteoporosis. Sedentary lifestyle, that, you know, just not getting
Sitting
up
around,
and
not bearing weight, not doing anything
that's
like
right. Alcohol, caffeine, and low estrogen levels, all of those will cause osteoporosis as well.
Mm-hmm.
In addition to that, we have inflammatory bowel disease like Crohn's disease. There's type 2 diabetes, which is the adult onset diabetes, which is 95% of diabetics actually have type 2 diabetes. And then there's prior hyperthyroidism, if you've had or have hyperthyroid. Dementia, probably simply because you fall easier.
Okay.
Because you get confused, you don't know where you're at. Family history, if your mother, your father had osteoporosis and fractures, advanced age, and there are certain types of medications that can cause that.
So these are risk factors. They're not causing it.
That's right. These are risk factors, and these are factors that the traditional medical community focus in on. Mm-hmm. In addition to the fact that calcium deficiency is the main underlying idea behind all of these factors actually in traditional medical.
Maybe you're going to talk about these more, but let me ask a question about a couple of them if you don't mind.
Sure.
How is smoking or tobacco use related to osteoporosis?
Smoking, it probably increases calcium excretion.
Oh, okay.
Is probably how that works.
So it's kind of like a diuretic?
It's like a diuretic, the nicotine.
The nicotine.
And so that's probably the main.
And then the inflammatory bowel disease, does this mean they don't absorb the things they need to have strong bones?
That's most likely, right.
Okay. Now, you said that that's the common list, but you also told me that there's one that just doesn't get the kind of press it needs to get that's a real big risk factor.
That's right. And many physicians don't even realize this or haven't studied this, and that is a high-protein diet. A high-protein diet, I find, is actually the main underlying cause for so much osteoporosis in this country. In fact, there have been multiple epidemiologic studies that indicate the high-protein diet as the primary cause for the osteoporosis.
So usually you hear people say, well, you need to get your protein.
That's right. That's right. We're very concerned about that in this country.
That's right. Where's your protein?
That's right. And
but you're saying you need to get rid of your protein.
Yeah, we get way too much. In this country, we consume well over 100 grams of protein a day, and studies have shown that actually those societies, those countries that have the highest rates of osteoporotic fractures actually are those countries that consume the most protein, especially the most dairy and animal proteins, because after all, if we're going to get over 100 grams of protein a day, it's generally from concentrated protein sources such as milk, such as cheese, and meats.
All those different things that are really high in protein. Are there certain types of proteins that cause more osteoporosis than others?
Yeah, that's an interesting question, because we find that animal protein actually causes more calcium excretion from the body than does vegetable
protein?
That's
Oh, okay.
right, plant protein. So the type of protein that we get is also very important, in addition to the fact of just getting too much protein.
I might say something. You know, this program's seen around the world. In some countries, in some places, people are suffering from diseases that come as a result of a deficiency, not enough of this or that, starvation.
That's right.
All this different things. We're talking primarily about a concern that's a Western disease. Am I right about that?
That's right. Osteoporosis is definitely a Western disease.
So if someone's watching today in a place where they don't have hardly anything to eat at all, they can't be saying, well, I don't want to eat that because it doesn't have it has too much protein.
That's right. That's a good
Okay.
That's a good point. Well, I'm mainly addressing the
Western
diseases that we see in Scandinavia, throughout Europe,
And Americas.
in America, North America, where we've really exported our high-fat diet and high-protein diet.
Wherever you see the golden arches, probably there's a problem.
That's right.
Actually diagnosing osteoporosis, how do you really make that diagnosis? Do you take someone's bones out and look at them, or how do you do that?
Well, that would be one way to do it, but most patients really disagree with that.
I imagine they do.
So what we've decided to do, rather than go in and take their bones out, or even go in and take a biopsy of their bones, which would be very painful and expensive and difficult to do, what we do is an X-ray study. It's called densitometry, bone densitometry, or just a bone density study, and we can actually measure the amount of bone that is there. We mainly look at the vertebral bodies in the lower back and in the hip. Those are the main ones, but we can also look in the arm bones there.
Mm-hmm.
The other thing we can look at is bone markers that we find in the urine. There are some tests that we can look at that actually measures the metabolism of bone. And so if these are really high, we know we may be losing bone. And so that would be a good predictor that we might be on the road towards osteoporosis.
All those things, looking at the urine, those kind of tests, well, I don't know, what would it be, like creatinine clearance we sometimes look at in the urine?
They're actually links, the pyridine links is actually what we'd be looking at in the urine. And most laboratories really aren't keyed into that, or physicians, and what you need to do is find a physician who would be keyed into that, and there are certain labs that can be used across this country to measure that.
So let's say I have osteoporosis, or my wife has it, or my grandmother has it, or my aunt has it, or my uncle has it, and you know, especially we're talking about women's health, and we know that's an issue. What's the treatment? What should we be looking for, pointing them toward? What kind of treatment are they going to be offered? What kind of treatment should they have?
Yes. Well, the standard fare in this country for treating osteoporosis is estrogen therapy, bisphosphonates, which are certain medications that we can talk about in a few minutes here. Designer estrogens, what I call designer estrogens, it'd be like a Vista, Relaxafine, which is a medication that binds on certain estrogen receptors but not on others.
Okay.
And calcium and calcitonin. And so that's the standard treatment, and we're looking at, you see there, we're really looking at medications. Pills is how we primarily treat osteoporosis in this country. And we treat it, and the first treatment really that we talk about is estrogen.
With women.
With women is estrogen and calcium. Those two things, because we see it as a calcium deficiency disease.
And in the milk industry and different things, they certainly promote that too, don't they?
Absolutely. They promote that very, very ardently, that we need our protein, and we need to take milk and dairy products to get our calcium.
And then also increasing weight bearing. They talk about that too, probably.
Sure, yes.
Yeah. So again, maybe your concern is that this is not broad enough of a focus.
Yeah, we're not. I certainly wouldn't have any problem with us talking about making sure we get enough calcium, though we probably don't need as much calcium as we think if we're eating correctly. That is getting 50 grams or less of protein a day. 40, 50 grams of protein should be fine. And in fact, that's what the World Health Organization recommends for daily consumption.
So what are the things that they're not focusing on that we should be focusing on?
That the traditional medical,
yeah, right.
Well, the main one, as I've said, would be the lifestyle issues of getting the right type of protein and not too much protein. But also, we certainly need to be looking at caffeine, alcohol, tobacco. These are also lifestyle issues that definitely contribute to osteoporosis as well. We could, what I call, age-proof our homes, and as we get older, we can fall easier. And we don't want to fall because now our bones are thinner and we could have a fracture. And so just doing things like taking the throw rugs out of the house so that you're not going to trip over that, and some things like that is some easy things that we can do.
So in other words, we can talk about the building blocks that help take away our bone mass and not ingest those, like caffeine and whatnot. What about coffee or caffeine or those kind of things? What really happens? Why is it that we're losing bone mass if we drink those kind of things?
Probably all of the, including protein, one of the mechanisms that it causes is linked to osteoporosis is because it is taking calcium out of the body. And so with coffee, with the caffeine that we have in there, it acts as a diuretic, and it takes calcium out of our bone. And interestingly enough, you look at coffee, and you want to know what is that's a fluid. It's all water, right?
That's what it looks like.
Yeah, that's what it looks like. But actually, the net water intake to our bodies is only about 1/2 to 2/3 of every cup that we drink, because the rest of it is going out in the urine because it acts as a diuretic. As opposed to if you just drink plain water, then 100% of that is a net increase of water in our body. And so that's how coffee or any caffeinated beverage will increase the amount of calcium that we lose in the urine. Protein, that's one of its mechanisms too, because
diuretic.
As a diuretic, because one of the breakdown products of protein is urea nitrogen, and that acts as a diuretic. Not to mention the fact that protein, if you get too much, is protein is amino acid, right? And so you have all these amino acids. Those are obviously acid. The body is alkaline, and to normalize that, to alkalinize the body, we buffer that with calcium, and it's the most ready source that our body has.
We're talking with Dr. Eric Shadle. We've been talking about osteoporosis. We've been talking about what commonly is done, why it occurs, what commonly is done to treat it. When we come back, we're going to look at some other treatment things, some things that you can do. Maybe you know you have osteoporosis or someone that does. We hope you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking about women's health issues. We've been talking about osteoporosis with Dr. Eric Shadle. We're glad you're with us, and you've been leading us on a journey about this killer disease, or what we would say killer of the bone disease, right. Osteoporosis, that causes all kinds of problems, especially with women when they're aging, which brings up an interesting topic. Before we talked about the role of estrogens in heart disease, and that certainly is a mixed bag. It doesn't seem as though it really helps with that. Although there are still studies going on, we're not ready to say we made the decision here on this program, but it seems like it doesn't have that bigger role. But with osteoporosis, is estrogen replacement therapy or estrogen therapy, is that something we should be looking at?
It certainly has been shown in many retrospective studies. In fact, it is confirmed in every retrospective study that's ever been done to prevent bone loss. So it would prevent osteoporosis, and it's actually been shown in studies to decrease fracture risk. So estrogen is something that we need to look at when we're talking about osteoporosis.
And retroactive studies, that means looking back, the people that didn't have it versus those that...
Right. You don't have a good control group. You don't have a prospective study where you're going to say, okay, I'm going to take a group of women on estrogen and a group off of estrogen and control for every other factor in their lives, and then look 5 years later or 10 years later. Yeah, it's a difficult thing to do. So what they do is look back. There are problems with those types of studies, but it is impressive that every one of the studies say the same thing. So most authorities really feel that estrogen does help to prevent osteoporosis. But I guess the question really is, who would need to take the estrogen? And that's a harder question. And I do think there are women that would benefit from taking estrogen, especially women who are unwilling to make some lifestyle changes. Some simple lifestyle changes to decrease the amount of protein intake that they would consume in a day is one of the big things.
So if you are not willing to make some lifestyle changes, you need to be thinking about maybe estrogen therapy and talking to someone like you. But you do have some time to figure it out.
That's right. There is time, because it is a slowly progressive disease, and it's not something that you shouldn't feel pressured to make a decision today.
Some people talk about what's called natural occurring progesterone and that treatment for osteoporosis. What do you think about that?
That's right. Well, synthetic progesterone, those progesterones that's made in the laboratory that most pharmaceutical companies have patents on, definitely does not prevent osteoporosis, but the natural occurring progesterone in a transdermal cream, some studies have indicated that it may help to prevent osteoporosis.
Okay.
However, most of the good studies from peer-reviewed journals in obstetrics and gynecology, for example, do not confirm that natural progesterone will prevent osteoporosis. So the jury is definitely out on that one.
So we can't say for sure whether or not on that, but
right.
It may not help, but it probably won't hurt. Would that be safe to say?
I think that's safe.
Okay. What about diet and the prevention of osteoporosis? What's the role that plays?
Well, as I noted earlier, I believe that diet is the most important single factor in the development of osteoporosis. There's just no question that our high protein diets cause us to lose bone mass. You know, for every glass of milk you consume, there's a net loss of more than 30 milligrams of calcium from the body.
Wait a minute. Milk is supposed to be the thing that helps this, and you're saying you lose calcium when you drink milk.
For every glass of milk. And these are multiple studies that have shown that. In fact, one of the most recent studies comes out of the University of Wisconsin in Madison, the dairy state, and that study has not seen the light of day too much, but it's definitely there. It's been done. And we find that you just cannot take enough calcium if you're consuming too much protein, especially concentrated protein such as in milk.
Wow. So when they say drink milk and, you know, all those commercials.
That's right. It does the body good, it says.
Boy, you're really, your bones are thinning as you drink it, especially if you're a lady.
Yeah, because first of all, the calcium that's in milk, you only absorb about 1/3 of it, as opposed to most plant sources where you absorb 2/3 or more. And secondly, it's a big protein concentration, and you lose calcium because of that.
So what are some food sources then? If milk is not the best, what are the food things? What are the things we should be eating?
Well, the easy way to say that would just be green leafy vegetables, but there are some that are better than others. Actually, spinach is very high in calcium, but the oxalic acid in it prevents its absorption as good as as much as in other vegetables. The number one source is what is a weed in most places. It's called lamb's quarters. It's actually a green leafy vegetable. Carob flour, interestingly enough, also is very high in calcium.
Carob flour. So
Carob
like
flour.
The plant source of carob.
Right.
Mm-hmm.
And just eating a diet that is high in vegetables with a variety of color and a variety of types of vegetables, we're going to be just fine with calcium.
So grain, soy, figs, hazelnuts, sesame seeds, all that stuff you have listed here, and kale, those are all good things. Just take whatever's on that.
That's right. If it's a green leafy vegetable, eat it.
Now,
enjoy it.
One other thing before we close this, this is a fascinating talk on osteoporosis because it's completely different than what you hear in the media. But one thing you've said is that when we talk about calcium sources, or protein sources, so many times these rat studies that are done, and they say that tells us we need a bunch of protein. But what you're telling me is that.
Yeah, interestingly enough, the studies that were done to tell us how much protein we need were done on rats. And if you look at different mammals and the amount of protein in the mother's milk of that species, you find that the protein amount, the concentration of protein in each species' milk is related to the doubling size of birth weight, how long it takes to double birth weight. So for example, a rat is born, and 4.5 days later it doubles its birth weight. And so it has 11.8 grams per deciliter of protein in a rat's milk. Whereas if we would take something like a goat, it takes 19 days to double its birth weight, and it only has 4.1 gram per deciliter. And then you take a human, which takes 120 days
to double its birth weight. You only have 1.2 grams per deciliter. So I think God is giving us the formula right in milk, in our own species milk, about how much protein
we need.
As it relates to osteoporosis. We've been talking with Dr. Eric Shadle. We've been talking about osteoporosis. Again, we've come to a conclusion. God's way is the best way. Eating what He's produced and He's provided can certainly help us with our bone health. We hope that you've enjoyed this program, and as a result, you'll have health that lasts for a lifetime.